We are dealing with a very high-cost healthcare nation, and we need to start thinking about how do we start doing things earlier in life, more preventative, so we don't have such high-risk episodes happening later in our lives. One of the things that we're doing at UPMC Enterprises is really thinking about how can we get the data that's most useful for doctors to tell that story of things that they need to talk to their patients about, to start doing more preventive care. What are the problems? Why don't they have this information? Where might this information live? How do we pull it out? What would they like to see to make it actionable? We tested some concepts. We got some really great feedback, enabling us to further develop the tools that we're going to bring to market. I think when the light bulb went off for me when I was in the MIIPS program was learning about human-centered design methodologies, tools and techniques, and really talking to the user of whether it's a product you're developing or a service that you're developing, and why it's important to understand what the problems are that user is experiencing. So you can really develop something innovative, something useful and meaningful and valuable to that person. Maybe my depth is in design, but I've had to build my business acumen, I've had to build my technical acumen to be able to tell a cohesive story and to get buy-in, because at the end of the day, we want to commercialize products in the healthcare space. So it's really bringing those together and making sure you're addressing the right audience and telling that whole story where those things all intersect.